Hi, I'm Dr. Neil Floch, and I'm very appreciative and thankful for being here today and presenting at the SAGES virtual meeting. We're going to be talking about the role of engaging the community, marketing, and social media in building your bariatric program. I have nothing to disclose. So, in order to build a great program, you do need support. You need financial support to build the program comprehensively with all the pieces that you need and to develop marketing that is necessary to propagate the success of the program. So we start off by communicating with both the patient community and the doctor community. And we do that with live seminars, which are best to meet the patients. However, in this COVID-19 pandemic, we found that virtual seminars have been very helpful. They're available to patients 24 hours a day, 7 days a week. When creating these seminars, whether they're live or virtual, you want to create verbiage that is at a lower grade level, that is simple, that patients can understand. Not only are patients speak a different language than we do, but they may be tired at the end of the day when they're listening to your seminar. So make it simple. We also want to make these seminars in languages that people understand. A lot of our patients may speak a different language, such as Spanish or Portuguese or Italian or etc. The seminars should be short. They should be about 30 minutes or 45 minutes at most, and leaving a lot of time for questions because many patients may be knowledgeable about bariatric surgery, but they may have questions that they want to ask you live. Follow with an online educational program that the patient can go to and learn more about the disease process and about bariatric surgery. Educational seminars are not just for the patient. Many physicians that we deal with every day may not be as knowledgeable about bariatric surgery as you may believe. So not only is it the primary care doctors and the nurse practitioners that you want to speak to, but it may be the endocrinologists, the orthopedic surgeons, oncologists, gastroenterologists. It may be any doctor. So you want to present to physicians. Well, what should we say? Now, first of all, obesity is a disease, and obesity is a complex disease, and it depends on many, many different factors, whether it's genetics, environment, upbringing, and behavior. There's subtleties of all of these that we can see in a very complex nature of this disease. We want to talk about the surgery, but also what the surgery can do. And if you're an orthopedic surgeon, you realize that many more patients can get knee replacements or hip replacements if they simply lose weight. Now, losing weight is not simple, but bariatric surgery can help with that. We can also reduce the risk for 13 different cancers, and surgery can put diabetes into remission. These are just a few of the benefits of bariatric surgery that we need to explain to our physicians. Now, who are we speaking to? Well, we're speaking to the world because obesity affects 42% of Americans. The disease affects everyone because, well, those 42% of the population are related to other people, so they care about them. And we need to speak volumes to the population. The website is our greatest part of our marketing program. It is important because that's where people are eventually going to go. They're going to go to the website to see a virtual seminar, to sign up, to find out more information. So it's really the base camp of what you're doing with your marketing program. Advantages, it's always available. It's got good information, but disadvantages are that that information may not be timely and it may be rarely updated. So you want to make your website patient-friendly, Put it at a lower grade level language. Be clear and concise. A microsite of a larger site is very helpful. And this is only something that your marketing team would buy into. It must be easy to find on a large site and easy to find call to action buttons, such as making an appointment or attending a seminar or a virtual seminar. You want before and after pictures, and you want to celebrate patient successes. For instance, in my private practice, every year we would have a fashion show, and the fashion show could be advertised, promoting it. This would gain awareness about bariatric surgery, and you would have old and new patients who would meet each other and tell stories after the event. Hospital workers could see the success and share in the joy, and this would help to promote the program in the hospital environment. Now, most people are on their phone, so going to a computer and going to a website on the computer is not what most people are doing these days. They're going quickly to their phone. The website has to be geared towards your phone so that patients can even sign up to an online seminar and go all on the phone. Your personal participation improves the website search engine optimization, and your personal participation will include everything in social media, including having personal blogs, personal Instagram, making YouTube videos. All this contributes to the power of your website. And if you want the best results, you're going to need to participate in all this. Advertising. Advertising is not always under the control of the bariatric surgeon, but understanding what's important is important. And the king of all advertising these days is Google AdWords. Why? Because if patients are on their phone and on the internet, they're going to see, when they click in, they're going to see the Google AdWords first. You can build the search engine optimization of your website by creating all those advantages that I told you about. But advertising will come up first, and that is costly. There are other aspects of advertising that are also important, such as responsive advertising, where if you go to a website, that website will creep back and come up on you because you visited there. Geofencing is when you go to a location, a geographical location, and you're actually there and you click on your phone and that advertising will visit you. And Facebook advertising is becoming very popular. Facebook advertising is actually much cheaper than Google AdWords. You want to develop an email list. You also want to develop a newsletter that you can send out on your email list. Television is the king of all advertising, but it's quite costly. It can be very successful if you're willing to spend the money to make good ads. And billboards are also a luxury, as well as advertising in movie theaters. Here's some of the messaging that I've seen on billboards, and I can tell you what works and what may not be so good. First of all, stigmatizing pictures are never good. It's never putting a positive on what we do. So patients don't like that. They feel not so great to see themselves in this kind of light. You also, although it's nice to show that you're a great doctor and you may be a top doctor, that is not always the best message to promote. What we want to promote is the patients and the patient successes, real people, real results. That's a good message, as is before and after, we're here for you with a wonderful picture. These are the positives of bariatric surgery that we want to emphasize. Now, social media can help to promote your practice and yourself, your brand. We can use different social media applications, but I also want to talk about some groups, online groups, and virtual support groups. First of all, you want to depend on a website and a marketing team to run a social media campaign, but you don't want to depend on them to do all of it. You have to participate. The advantages when you don't do any work are really no work, but the disadvantages are poor interactivity, poor response, and significantly less effective marketing plan. You want to become involved with all the social media applications so that you can support your program and build your personal brand as a bariatric surgeon. I use this example of coffee and talking about coffee and the different things you can do. Twitter, you can dance around, you can show a video, you can talk about articles about coffee. Facebook, well, you can talk about Facebook among your friends and you can talk about coffee amongst your friends. Instagram shows a great picture of drinking coffee, somewhere beautiful, somewhere great, and your experience. LinkedIn, you want to talk about the professional aspects of the coffee. And YouTube, it's a video of coffee. Well, we really want to talk about bariatric surgery. So we're going to show videos and pictures of that and talk about it professionally. The most professional application is LinkedIn. And you can put your CV online, you can talk about articles, you can talk about information. I found most effectively that Twitter is best for promoting articles and spreading them. And if you really want to promote your brand, you can spread it online and the media will see it. The media is on Twitter, and Twitter is a very powerful application to build your brand. If we want to show videos, the best place is YouTube. And if we want to see surgeries, well, we don't have to go into the operating room anymore, I'll tell you that. We can see them online at home at any time. And if you want to show off your technique, best way to do it is YouTube. Videos of this time to act for obesity were very successful. Explanatory whiteboards are great for telling about obesity and bariatric surgery. The ASMBS and Stacy Breathauer have created some of the best whiteboards I've seen, and we use them on our website. Before and after pictures are great. They're great for academic surgeons and for private practice surgeons alike. The before and after picture is very helpful because it's informative. It brings on our emotion, our sympathy, and it shows patients' transformations. Content is important. It's also great to have a Facebook practice page. If you're in private practice, this is wonderful. Also, if you're in academic practice, it's almost like a second website. It's more dynamic and interactive. It's easier to change this Facebook page than it is to change your website. Now, patients are communicating, and you can have a closed Facebook support group for your practice, or you can have one or visit one or have patients visit the many support groups that are out there that are private. I believe it's good to control your Facebook support group and keep it closed, inviting in only the patients that are going to be supportive and helpful. And this is something that should be run by someone who is in your group or your practice. Instagram is great for the before and after picture, and having these and supporting these and doing these is wonderful. Instagram is where the patients are, and it's a great opportunity to promote patient successes. If you're not promoting, well, patients are on Instagram and especially on Facebook talking about you in groups. So you better get online and you better participate. Facebook is great for Facebook Live. It's great for virtual support groups that can also be performed live. So when you want to promote yourself as a surgeon, you want to promote your individual brand and uniqueness. The public wants to know you as a person, and they want you privately. So you need to promote yourself a little bit differently when on Twitter and Facebook and Instagram, promoting yourself as a surgeon. Bariatric surgery is a great profession, and promoting yourself in a professional manner can continue. You should perform live and virtual seminars to patients and doctors. You want to work with your marketing team to build advertising, and let your marketing team post routine content on all sites, but you also need to participate. Joining LinkedIn can be your most professional presence, but it's not necessarily your most effective. You need to join Twitter to tweet commentary about articles and educate others. Instagram is great for your patients, for their post-op before and after pictures. Join Facebook for posting live and virtual support groups, and participate in these support groups, especially you want to be within that Facebook group to encourage online support. It's important to remember that obesity is a disease. We need to say it, believe it, own it, preach it, tweet it, and promote it. Thank you very much for this great opportunity.